founder of Keith RN, and it's my passion as a nurse educator and a nurse in practice to strengthen and transform how nursing is taught so our students are better prepared for both practice as well as licensure. And, I'm all about helping us close the gap between how nursing is taught and practiced in the real world. And it's just great to be with you tonight. I want to just let you give me a shout out for who's out there in our audience tonight. Let me know where you're from and who you are, and excited to have you with us. And just want to thank you for taking time out of your busy schedule to be here this evening. And if you're checking, as we look at just the challenges that we face, in nursing education, we look at the struggles to really bridge this gap between how nursing is taught and practiced. And as I shared last week, I talked about the paradigm shifts in educating nurses, a call for radical transformation. And this book rocked my world as a new educator, and it's really is still a must read, because many of the paradigm changes that we've discussed in the past, and we're going to talk about the fourth and final paradigm shift today with a special guest, Dr. Nelda Godfrey. But in essence, I want to highlight that there are three that I've kind of focused in my journey, which is about the importance of contextualizing our content to the bedside of patient care, integrating class and clinical learning, and then emphasizing clinical reasoning. But there's also a fourth paradigm shift that I didn't really understand as a newer educator, and it's this: a shift to emphasize socialization and role-taking to an emphasis on formation and professional identity formation. Now, that language was somewhat obscure to me as a new educator, but I have a guest tonight, Dr. Nelda Godfrey, who is going to shine some light on this really important topic in nursing education. And Dr. Godfrey is the Associate Dean for Innovation at the University of Kansas School of Nursing and the chair of the International Society for Professional Identity in Nursing. And this group came about in 2018 when people interested in this topic, this think tank. Let me just increase the size of my screen here. I just got a little problem reading my bio here. As it relates to professional identity and what the domains would be to make up professional identity in nursing. And since that time, there have been over 13 publications, 16 presentations nationally and internationally, and an overwhelming response globally to conceptual model of development, these ideas and tenets of what is professional identity and why it's important to develop this in our students. And so Nelda's going to share the goals of this innovative initiative, the progress so far, and ways that new language and knowledge about professional identity in nursing can become part of our undergraduate and graduate nursing programs, not only here in the United States, but globally. And so, if something's not in the curriculum, as we know, it doesn't get taught, and we could do a better job. And so we're going to have Dr. Godfrey join us here. And Dr. Nelda, I'm just excited to have you here with us tonight. And I want to thank you for taking time out of your schedule to be a part of this conversation. So thank you again.
My pleasure.
All right. Well, I've got, as we look at I always like to get the story of educators in the sense of what is it that in essence kind of attracted you to nursing as well as then nursing education? So just briefly share your story and your journey with us tonight.
Well, I think there are probably people on this call that are like me. You grew up in a rural area, and I certainly did. In Missouri, in the county that had the highest deer kill rate in the state, which means it was really rural. And in that area, in my little school, I liked science and I liked people and wound up in nursing for that reason. But the reason I went into nursing education is first of all, I didn't think I'd ever go into nursing education. The reason I went into it is I had my first clinical group and I fell like a rock. I thought, oh my gosh, this is the best thing I've ever seen. I could actually work with the students and watch them grow, watch the light bulb go on. It was a fabulous experience. And I started doing that really early, and I still keep doing teaching in one fashion or another. So.
Okay. And Nelda, you're a little bit humble, but you're a fellow in the American Academy of Nursing. Otherwise, that's a fan. If you understand, it's an FAAN, but it's a prestigious distinction. And that was back in 2012. And so I'd just like to know, what was your body of work, or what did you do with some of the innovative things you've done in nursing education to earn that distinction?
Well, it really does go back to professional identity work, along with being a co-lead for the Missouri Action Coalition with the Robert Wood Johnson First Future of Nursing report. But that was one part. The other part was the professional identity in nursing, which is being brave enough to approach philosophy in nursing in our very, very young academic discipline. So to illustrate that, the very first PhD in the world was in the 12th or 13th century in theology or philosophy. The very first PhD in the world in nursing was in about 1970. Well, there are probably, maybe, some people on this call who have a memory of 1970. And so we've had such a short runway, but oh my word, have we done so many things to make our discipline just fly. And so my work was in philosophy, and has emerged into professional identity and professional ethics since then.
So basically, so would you say that your desire for philosophy, Nelda, has influenced, it's kind of like, we all have a passion, there's passions that I believe are there for a reason. And it's kind of like, for me, my passion is to really, empower educators to transform the way they teach so that development of clinical judgment can be realized. And for you, it's like, did you see things in nursing education where it's like, we're struggling? Did you see a need, kind of like I have, where we have a problem here, or however you want to phrase that, and I need to be a part of the solution? I mean, was there kind of more to it than that?
Well, I think you've said it really well, but I'll put it in context. I had the opportunity to teach at a top 100 liberal arts college for 23 years. And 14 of those years I taught in the liberal studies curriculum. So I taught Maya Angelou's I Know Why the Caged Bird Sings. And then she came to campus, and I was able to meet her and talk with her. And to have exposure to big thinking, and to teach St. Augustine's Confessions, and to teach E.O. Wilson's Consilience, it really bends your mind into different places. And so having kind of a classics education by doing the work I was doing, it made me take a look at nursing and say, we've got to do some things to fill in these holes. We are a full-fledged discipline that needs to have strong strength in philosophy as well. So I've kind of opened up that conversation, I think.
Yeah, no, excellent. And, one of the things, and we were talking about this before we came on, Nelda, but, I read in our editorial in the New York Times today, and actually there's a link that I hope that Amy is going to share with us, who's kind of moderating this chat, but the op-ed, and you can Google this as well, nurses are barely holding themselves together. And basically what it addressed was a nurse journalist who went into nursing, and in essence is identifying the dilemmas that nurses are facing in practice, including the inadequate staffing, the burnout. The rates of burnout, she says, have gone from 25% on average to now almost 70% among all nurses in practice, because in part of the pandemic. But she also brought in, Nelda, this dynamic of moral injury that is typically used in the context of combat soldiers who are forced to do things that violate their conscience and their ethical principles, and how nurses in this COVID pandemic currently are experiencing moral injury because of things like seeing patients die alone, patients that they don't have the time to adequately care for, and compromising their ethical principles to provide the best possible patient care. And so when we look at the importance of preparing students for practice, it seems like this aspect of really helping students who will become nurses in this pandemic when they graduate, it's like we need to prepare them for this reality. And the question is, how are we doing right now? And what could we begin to do differently to really address these moral issues and these dilemmas that address the heart of ethical and professional nursing practice.
Well, Keith, I want to thank you for bringing forward this editorial to all of us. I had not seen it until you brought it to my attention. It is a powerful editorial. And for those of us who have done any kind of direct care I used to work the weekends, always used to work the weekends, and in busy inner city hospitals. And so you can certainly hear in the voice of the author how difficult things are. And the moral injury that you speak of, that certainly is something that we're dealing with. And I think it started with the hit that we realized we were going to have to work in areas without adequate PPE.
Yeah.
And I think there are some hospitals that have done a fabulous job of not having that be a problem. And I think they have come out certainly more whole than those institutions that did not. So she speaks truth. Teresa Brown speaks truth in this editorial.
And so, when we look at this aspect now of professional identity formation and how we need to, it's like how we need to implement this is really a curriculum. I mean, would you agree that we need to make this a curricular kind of emphasis, that we don't just kind of, like, I think a lot of things like, like when I remember when I was an educator in one program, Nelda, in our mission statement and in our vision as a department, it was all about, we want caring nursing professionals. We want our nurses to be caring and compassionate. But then when I looked at the curriculum and what was taught at fundamentals, first, second, third, fourth semester, there was no content on caring. It was kind of like osmosis, like they're just going to be in our department as nurses, and they're just going to get these values of like caring and ethical professional practice. And I just found that ironic that where I've taught, I haven't seen that intentionalized and integrated in the curriculum. And is that a common dynamic, or is that pretty common or pretty typical from your experience?
Well, you mentioned Benner's book, Educating Nurses, a Call for Radical Transformation. And that was such an important study. And the study was carried out in 10 different sites. And what Benner's crew found was that that it did come out, the comportment that we hoped for, the identity formation did come out in clinical, and it was very person dependent. And what all that translates to is that unless you make it clear, it doesn't happen in a concentrated or consistent way. So yes, there were some clinical faculty who did a marvelous job, but a lot who did not. So whenever you don't make something clear, you end up having it be lost. You mentioned that earlier as we were talking.
And so from what I understand, Nelda, you want to make professional identity formation clear as it can be. And I think we first have to do that by defining it. Do we not?
Exactly.
And so from what I understand, you and the work groups that you have initiated have begun that work to really begin to identify the pillars of professional identity formation. And I think if I could unpackage them, I'm going to put them one at a time on the screen as you have defined them, or how your work group. I mean, who has defined these, Nelda? Was this like a collaborative effort? If you could just explain the history of how these came to be, so there's a context.
So I think you have to hear me as a farm girl and as somebody who likes philosophy, because I think both parts of that came into the making of this. So understanding that we were bereft, that our discipline is bereft about philosophical perspectives and needs to develop those. That's one thing. But also, we could talk in high, lofty clouds all we want, but no one would ever talk to us. So in 2018, I thought it was time to get a group of people together from all over the country and Canada to be part of a think tank and to offer a definition that talks about thinking, feeling, and acting like a nurse. And it may be, Keith, that you put that up at some point. But we ended up with a definition that was really much broader than most empirical definitions, hence the philosophy influence. But then what we did very practically is we said, all right, 50 nurse leaders, equally representing education, regulation, and practice. Students, graduate students, chief nursing officers, people on boards of nursing, people from all over the country, and then, as I said, including Canada. If we were going to ask you how many domains there would be of professional identity, what would you say? And then what would you say those domains would be? So it was a truly iterative process that our facilitators took us through. So our group came up with 4 domains. And
I will start with domain number 1.
Domain number 1. Domain number 1 is values and ethics, which only makes sense because most of us who like ethics are pretty sure that every action we have in nursing is an ethical action. So 1 is values and ethics. 2 is knowledge.
Yep.
3 is leadership. And 4 is professional comportment. So even though I was talking rather lofty earlier, think about this. These are 4 terms that can be operationally defined. Moreover, for the new student who's coming into the nursing program that you teach in, and I would argue our students are the very same as yours, I don't think they have any idea what nursing is about. So if they're coming into the field and trying to understand what we're about, we can say there are 4 signposts for nursing. 1 is values and ethics, 2 is knowledge, 3 is leadership, and 4 is professional comportment. And we're going to take our time with you during your 4 semesters or your 12-month accelerated program, and we're going to help you figure this out about how these 4 domains play out in the practice and in the profession of nursing.
And so now let's look at domain number 1. Let's unpackage these just a little bit further because these are just principles, but there's no let's flesh them out briefly in this conversation. So when you look at values and ethics, as you look at the work group, what are some of the foundational values and ethical behaviors that embody and still represent nursing practice today?
So I would start with honesty and respect and regard. I'm sure human dignity is a better way to say that. An understanding of human flourishing. I'm using very ethics-related terms, but that's what goes in that category. So those are examples. Then we could also use the bioethics terms like autonomy and beneficence and non-maleficence and justice. So that is sort of the basket of the values and ethics that surround nursing. Altruism in the literature shows up as a value, but those are examples of it.
Yeah. And what I really value about this work, especially the emphasis of value and ethics, is a couple heroes in nursing to me. Nightingale recognized the importance of character in the Nightingale schools, things like the same values of honesty and serving, for example, were highly regarded and expected by the Nightingale schools of nursing in England in the 1800s. But also Chris Tanner is one of my heroes. And as you know, she had the seminal article in 2006, Thinking Like a Nurse. But really, when you read the article, Nelda, beneath what is woven throughout that seminal article on thinking like a nurse, clinical judgment, is that she made it very clear that based on her looking at over 200 articles on the topic of clinical judgment, putting them all together, that clinical judgment is actually influenced more by what the nurse brings to the situation, which is really her ethical, her engagement, her caring, compassion, and what that looks like. And so in order to really think like a nurse, if I were to simplify it, you need to care as well as act like a nurse. It's not just think. That's, if we're just focusing on the cognitive clinical judgment, next gen NCLEX, we're missing it in nursing education. We've got to bring the whole package, Nelda. And that's the body of work that you're doing right now that really makes that caring, compassion, the values central and identifying them and being intentional with that and what that looks like. Am I on the right track?
You are on the right track. I feel badly that I didn't put caring and compassion in my list. I just didn't
But
get
they're there, are they not? That's
but
still
they
relevant.
are, of course they are. And I want to mention something. This whole idea of the term professional identity is a term that is being used in many disciplines, and in nearly every health profession. And it's important because that's language that translates across disciplines, and we need to be aware of it. How did it become important? In the early 2000s, medical educators at McGill University in Canada realized that they were trying to cognitively teach professionalism. So they would teach a class on professionalism, they would survey the students on professionalism, and then they would test the students on professionalism. And they realized that the behaviors that they were seeing from those students did not match their expectations. So they decided to step back and start looking at a broader base of literature. And they found themselves in developmental psychology, in the work of Marcia and Jameton about identity formation for adolescents and what that is like. And they stepped back and called it something different. They didn't call it professionalism anymore. They called it professional identity formation. They didn't test it in the same way anymore. They did it much more with reflection and reflective journals and experiences and reflecting on those experiences. And because that is now key and core to what happens in medical education, we know that that is a trend that we need to adopt in nursing education. Benner thought so too.
Yeah. And what's interesting, Nelda, too, when you look at the ethical and the behavior, it's like, one of the common things, the Facebook group that I have and that I'm an admin for, the Teachers Transforming Nursing Education. When I look at the posts, I'm just blown away by how many of them have to do with plagiarism, cheating, students getting around respondus browsers, and all of it's like a culture of plagiarism and cheating and a lack of honesty, a lack of integrity. And it's like, when you look at the culture that we often experience in nursing education, how can we begin to kind of raise that bar of expectation that though these things are available to you through the internet and other shortcuts and other ways of getting around certain things, that's not how you roll as a professional nurse. And it's like, it seems like we're losing that battle at a certain level. But how do we get the ground back, Nelda?
Well, I think this is a really serious matter. I think this is a really serious matter. And I think as clinical faculty and as classroom faculty, we're going to need to take this back. And we're going to need to have our administrators support us as we are putting things in place to eliminate or certainly vastly decrease cheating. There is no place for dishonest nurses in caring for people in their most vulnerable moments. There is no place for it. And I think that causes a great deal of moral distress for faculty when they are spending their first of all, they're spending way too much time transactionally interacting instead of transformatively interacting because of the chores that we have. But if we don't have administrative support to do something actively about the cheating business, I think we're going to tear our souls, and it's not going to be good for us.
And so what you're saying now, what I hear you saying is that we need academic leadership support to have, it's kind of like the death penalty, in essence, that, if there's documented plagiarism, cheating, that we will, whatever the student handbook, but having that follow through of like, you're out, or whatever disciplinary actions that are at a very, that it's not just a slap on the wrist. It's like, this is your future in the program.
Well, I think there are probably best practices around of schools that have policies that really do work. But then there are schools that have policies that don't work so well. We need to gather up what works best. And really it's moral distress for us in faculty roles when we have to deal with that. There are ways around some of it. So I had taught in the first professional development course at my university, and I really wanted the students to write essays that I could, to a certain prompt, and I wanted them not to plagiarize. And I was able to do it in a large computer classroom. but I graded 120 3-hour essays. And I had my own rubric and I could do it pretty fast, but I was at that point was so sick and tired of cheating that I thought, no, we're just not going to do it this way. Yeah. But I could in a class like that. That's not the same thing as teaching health and illness 1, 2, and 3. Yeah. And so that makes it even more difficult. So I do understand the difficulty of this.
Yeah. You know, and just a thought, Nelda, with the values and ethics, we're going to move on to the second tenet, which is knowledge here in just a second. But what's the faculty's responsibility to role model these values and ethics in our programs? And what does that look like from your perspective?
Well, the faculty, excuse me, I really believe faculty have this idea of professional identity stamped on their foreheads. They know exactly, you all know exactly what I'm talking about, because this is the best of what you want for each of the students that you interact with. So I'm not talking about anything new. You know this. What I'm hoping we can do is add some language to it. But it also has to start, excuse me, has to start with faculty. And so we talk about sodium and sodium in the cell. As goes sodium, so goes water, okay? Well, as go faculty, so go students. So we have to have an ethos among the faculty of all of those values, and a sense of support to be able to carry that off. I think there are some environments that don't allow that to happen, and I think there are some environments that do support it. And we just need to find out what those best practices are and help promote that among our schools.
Excellent. Thanks, Nelda. Let's go to number 2. Second domain or Prince, I like pillars, because pillars are they're like foundations that hold up the whole platform of professional identity, like Roman pillars, those columns. Second pillar is knowledge. What is that? Define that for us, Nelda, and just how does that relate to professional identity formation?
So we were trying to make this simple. And this is, again, what this think tank came up with, which I think is so important that it iteratively came out of group work to say that knowledge is one of 4 important pillars. I think about the evidence that supports this. I mean, by anybody's book, people who pass an NCLEX are knowledgeable. This is not for people who don't have brain power. So we are clearly knowledgeable to be licensed as registered nurses, and clearly knowledgeable to be licensed as licensed practical nurses. So I think it's an indisputable place. It's unfortunately culturally dampened by it being largely a female field, but we just need to try and change all these things if we can.
Yeah, I'm all for that, Nelda. I'm doing my best to be an advocate for that as well.
Thank you.
Well, when you look at knowledge, would it embody, though, in essence, kind of like, one of the challenges that we face in nursing education, Nelda, is infobesity. TMI. We have so much information. So it's kind of like, what knowledge and what are some of those core, does the work group kind of define or at least give some broad pictures of like some of those core aspects of competencies or knowledge that are central so we can focus on the need and not the nice to know?
I think that's long been a problem for us in nursing ed. And what I would say about that is I do think there are some ways we are coming up, and this is a personal opinion, there are some ways we're coming up that are helping. And I do think conceptual learning does help with this. It makes us not feel as though we have to teach the name of every disease, the cause of every disease, the treatment for every disease, and the nursing implications for every disease by using a conceptual model that helps us cluster this information. So, for example, many schools have a beginning nursing class, like a beginning course, an introduction to nursing, or an issues and roles course. The introduction to professional development course that I developed has 3 concepts in it. And it's a baccalaureate program, so it might be different if it's an associate degree program. But the 3 concepts in that 16-week course are scholarship first, professional identity second, and caring third. Now think about what a foundation that gives to the students as they can move forward. And that does underscore the fact that a knowledge approach can really end up helping. I also think the reason that concepts are especially good is that you don't feel so possessive of everything you have. We've all done it where we say, oh my gosh, if I don't teach this now, no one after me will ever teach this to these students in this way. And by having concepts assigned to us and those that we're responsible for, I think we do a better job for our students. You brought up the nice to know and the need to know. That is a tough nut. It's really tough for us. I think better metrics are going to help us know what's necessary. The new ACN essentials are going to be a good addition. So I think we're getting better at knowing what that knowledge corpus is.
Excellent. Well, now let's get to pillar number 3, and that's leadership. Leadership. Let's unpackage that briefly as far as just kind of the leadership responsibility of the nurse. What does that look like, and how do we incorporate, what does that look like in our programs?
Well, I think for all of us who are nurse educators, we have used the word leadership so much that it has lost meaning. And that is a shame, because we could certainly use with quite a little bit more of that on our day-to-day practice, where we are stepping forward. And Terry Valiga describes leadership as anyone who is making a difference. So what a beautiful way to say it, because we know every day, especially if we're in practice, we know every day we are making a difference. So it might sound heady, and I've had people tell me, oh, it needs to be leader, not leadership, and all of that, but we have a ways to go in terms of our own gravitas, our own presence, our own sense of how we're presenting ourselves as the professionals that we are, who are in sacred spaces with our patients at the beginning of life and at the end of life. So leadership for me has a clinical perspective.
No, that's excellent. And let's go to the 4th and final pillar or domain, and that's professional comportment. Now, that's kind of a big word. Let's unpackage that so we all understand it. Is that how would you define professional comportment, Nelda? And how can we kind of identify and kind of validate our students as they develop these principles in our program and identify what that looks like?
Well, in the International Society for Professional Identity in Nursing, we really believe that these 4 pillars have application in education, practice, and regulation. But our practice colleagues do not always know what professional comportment means. In fact, it's a word they're just simply not familiar with. But those of us in education pretty much know what comportment means, and it means behavior. It means professional behaviors. And we've had trouble articulating this. I think we've had trouble. We try so very hard, and this is a conundrum I don't know how to solve quite yet, but I think we try so very hard to treat and to approach and then treat and interact with the patients and families we come in contact with an unconditional high regard. I think we try to assume positive intent. We meet them where they are. We try to help them move forward, and we are so open to their nuances because we respect them as human beings. And sometimes we translate that into the academic teaching environment. And I think it's misplaced. And I'll tell you a story about that because I learned this the hard way. We were starting a special accelerated program, and we had a small number of students, and we wanted all of these students to be successful. And we even worked with local hospitals to get some funding for the students to go through this. And we had a student who'd been an engineer who wanted to become a nurse. And the oddest thing was that as she got full funding for her 12 months of her accelerated BSN program, when she graduated and went to that organization to try and find a position, she interviewed with 4 different groups of nurses, and they said, no, thank you. We don't have a place for you. And I think what we did, I'll say we, I think what we did is we met this particular student where he or she was in such a way that we were so unconditional about the behaviors we saw that we didn't do what we didn't do what we were asked to do. We were asked to help prepare this person to become a nurse. And instead, we treated them with the unconditional regard that we do with patients. Sometimes I think we do that in regular faculty roles.
Right. And so, and that kind of brings me, Nelda, to the point of that, one of the things that as I look at professional identity formation, it seems to me we can look at models like, the diploma programs of the past where nurses were immersed in the culture of the nursing profession. They were in the clinical setting 5 days a week and immersed in culture. A recruit in the military is immersed in military culture in boot camp for those 4, 5, 6 weeks, and they become a raw recruit, but they come out a professional soldier. In nursing education, Nelda, we don't have that type of enculturation or immersion in the practice setting. In fact, our students aren't getting the clinical experiences now with the virtual translation as they need. And so that immersion in both academic and clinical settings, we're struggling. And so I would like to know your thoughts on how can we as educators and in nursing education as a whole, because we don't have that immersion opportunity any longer with the diploma programs, no longer really a model any longer for education. What are the things that we can do on both a micro level and a macro level to really strengthen this aspect in our programs and in our curriculum?
Well, I think the first thing we're going to have to own as faculty is that we have a role that might be different than we thought it was. I can think for many, many, many years, it was so important for me not to be the battle axe nursing instructor. And I did everything I could to be the most kind.
You nice Nelda. Nice Nelda. Was that
but I couldn't bear it. I couldn't bear the idea that I would be hard and make life miserable for a nursing student. Okay. But I think it was a knee jerk that I shouldn't have done. I think we should have a little different sense of it. But it goes back to this whole idea about professional identity, because we need to have the structures that help us move that forward. So if we're just relying on our personal sense as we teach, that's not enough. We're in a discipline. We need to be relying on our professional sense. And we ourselves need to define what these 4 pillars mean to us and how we articulate them as faculty. And then as a group, we need to talk about it and see what that is. It was early in my career, it was a bitter pill for a secretary who had graduated from the psychology department in my school to explain to us nursing faculty that we needed to quit calling ourselves by our first names. That the campus had 20 different majors, and we were the only major in which the students referred to the faculty by their first names. But we didn't see it. We were being warm and friendly and encouraging and all of that. And after that, we changed. We weren't any less encouraging. It's just that we needed to put on the mantle of the role that we had. So I think the first place is with faculty. And then it's with administrators that understand professional education is vastly different than, in my case, liberal arts education. And then we need to inculcate this language for our students so that they know. Students really want their own peers to behave well. I mean, you've known that for years. They're probably harder on their peers than they are on themselves. And I don't think we need to let that go rampant. But there is an expectation that is different than just being yourself when you're a nursing faculty.
Right. And, like anything, Nelda, when you look at the definition of curriculum, it's, the knowledge as well as the values of our profession and translating those intentionally to the next generation. And when you look at basically the curricular approach, I just briefly share in closing some of the things that you're doing at the University of Kansas to really integrate and make professional identity formation part of the curriculum in the courses that you're teaching that have made credit available for professional identity formation. You've made it a priority and you found room for it in your credits. Tell us about that, and just in essence, what those 3 courses look like and how you embed them into your baccalaureate curriculum, and what we as educators can learn in other programs across the United States and Canada.
Well, so the 3 courses are called Introduction to Professional Development, and then Values, Ethics, Image. So it's the ethics course. And the third is Navigating the Profession. So that was the 7 credit hours that went into that. Our students have just flourished by us devoting time to that. But think about it. I just mentioned the first course has 3 concepts: scholarship, professional identity, and caring. Well, what would be more intriguing to a brand new nursing student than to be covering that? I mean, that's why they came in the door, is to be able to do that. So I think that is something that we have learned that has helped. I think it has helped them be more grounded. I have another idea, and that is that in graduate programs, we often have roles and issues in doctoral education. Well, what if we called that course Professional Identity in Doctoral Education? Or if we took the roles and issues course in the baccalaureate program or the ADN program and changed it to Professional Identity in Associate Degree Education? I think we'd cover the same things, but we might put a frame around it that would be more useful to the student moving forward.
Okay, excellent. And, as we look at, just in closing, Nelda, do you have 1 or 2 pearls that, if you look at just educators who are struggling or who want to move this chain forward, you're willing to I've got your email address, Nelda. Can they contact you directly with any of their specific questions or challenges that they're facing, and just how they can learn more about professional identity formation?
So yes, I think Keith is going to put my email up, and please do contact me. We have a growing number of people who are interested in this. Being part of the International Society, we've had a global response that is unbelievable. We've had more than 40 countries participate in the webinars we've had through Sigma. This is something that is resonating with many, many nurses. We feel, or there is the thought that others are taking away our brand, that we are not managing our brand well, and that we need to take it back. Yeah. And so this is, without sounding exactly too rebellious, I think that if we have a greater interest in professional identity formation, it's really important. I want to mention that the International Society for Professional Identity in Nursing is free. There's no money associated with it. If you contact me and tell me you want to be part of this, all the bother you get is quarterly or more emails or newsletters, so you know what's going on. The real action is in the work groups. And I think if you are interested in this at all, if it stirs your soul, I would really encourage you to come aboard. We've got people from all over the world who are involved in this, trying to recast professional identity in nursing.
Yeah, excellent, Nelda. And I would like to know what kind of specific questions that educators have out there. So if you've got some specific questions for Nelda before we close here tonight, I would just, now's your chance to put anything in the chat, and we'll monitor that chat. But Lisa has just a statement here, Nelda, I'll put on the screen and you could comment on that. She said this, once we can determine our professional identity, we need to start to work with accrediting bodies and boards of nursing to assure we are testing for what our expectations are of nurses as educators, healthcare providers, and most importantly, students. Any thoughts or comments on that?
Well, I think you're right on target, Lisa. And I have some good news. The final draft of the ASTN Essentials has one of the 46 competencies is demonstrate a professional identity of nursing. It's going to challenge all of us to put words to this, to build this initiative out so it makes sense for us and for our students. We have lots of work to do with regulatory. So if you have any tips on that, I'd love to have, or any contacts in that area, I'd love to have some help with that.
Excellent. And Nelda, just in closing, what are some of the specific ways, educators have a very little bandwidth, typically, they don't have a lot of spare time. But what are some practical ways, if there are educators like myself who are passionate about this topic and see the need, what does participation in these work groups look like? So what are just some of the little things that are really big things that other educators can do to contribute? And just what does that look like practically with the time commitment, or just, just so they can kind of know that they're not, you're not going to bloodlet them with a lot of extra, what does that look like?
Well, a very, very small thing that we can all do, is we all are, especially in clinical, we are organizing clinical conferences, post-conferences, pre-conferences. If we could say, well, let me tell you about this term that is emerging in health professions, but certainly in nursing, and it's called professional identity. And we now know that professional identity is made up of 4 pillars. And as I talk about these 4 pillars, have you seen this in your program so far? Do you see how the nurses you admire are like this? So it's a way for you to start a conversation. The term is actually quite positive, and it has a much more positive connotation than the term professionalism. So we've already added something to the students by doing it. In terms of being part of this in a little bit larger way, wouldn't it be amazing if we could do what medicine has done and have it be a yes and proposition, where we talk about competency-based education like they do, and they also say, but we know professional identity formation is a part of the education. So it just sort of rolls in tandem instead of just all one thing or all another.
It's kind of like we got to get out of the silo mentality, Nelda. It's kind of like how we struggle. Even Dr. Benner talked about that. Clinical is in one silo and classrooms the other, and they struggle to intersect. We really need to have that trifecta of classroom, clinical, and professional identity formation that all intersect like a Venn diagram, and that professional comportment or professional identity is right in the middle of it. And everything else just kind of falls around it.
You are exactly correct. That is a great characterization. I couldn't add anything to it.
Excellent, Nelda. Well, listen, we've got the website that you shared with me about to learn more with the HTML document and whatever is there. It's a great place for any of you who are still on the chat, and we got a lot of educators still here, Nelda, that are to go to that link, and as well as email Dr. Godfrey with any questions. And Melissa has a question. How would you recommend? Let's just talk about it. This is a great question. In closing, how would you recommend including this in class or clinical when faculty seem overwhelmed by transitioning back and forth with face-to-face and virtual learning? It seems many do not want to add anything more on their platter at this time.
Well, I think we educators, as particularly, I would say, pre-licensure educators, are really in a crisis mode right now. This is very, very difficult. We are creatives, or we would never be teaching. And now we are relegated to doing transactional work with some learning management system, and everything is transactional and none of it's transformational. So I think if we recognize that, that's the first thing. And then secondly, to bring forward the idea of professional identity, I think you would be fascinated about if you presented this in 10 minutes and then had the students do a 5-minute reflection on what they thought about bringing forward these 4 pillars of professional identity. I think you would be astonished at what they had to say. So even if you give them a little chance, and even if you have them do a 5-minute essay that you don't grade, that would allow them to have a glimpse of a larger view of what it means to be a professional in this field.
I just had a thought, Nelda, that I'll just share as a reflective assignment that I would love every educator to do out there. Identify some of those values that Nelda talked about, those specific ones, whether it be caring, compassion, honesty, and then have them reflect individually. Integrity is basically who you are in private is who you are in public. How integrated are you currently with these values? Where do you need to strengthen? What's a current weakness? What do you need to strengthen as it relates to professional identity and these values of the professional nurse? So you identify using some of the things, whether it be the concepts that are in Giddens' text on professional identity, or your own values, or nightingales. They're on the internet. Look up Nightingale's character values of a nurse. They're still relevant. And then have students reflect on that. You know, that's really, I think, a very powerful activity, Nelda, that would just be a simple thing that any educator could do tomorrow as a reflection.
And I think you would find that the students crave an opportunity to do this.
Yeah, excellent. And we just have to define it for them now. That's kind of like, we have to kind of just show them that path. This is the way, walk in it. And we have to make that path clear to our students. That's our responsibility, and we have to make time for it and make it a priority in our programs, that this is not just like a side dish. This is part of the main dish of professional nursing practice. So blessings to you, Nelda. There's no other questions. It's been a pleasure to have you here with me tonight. And thank you for taking time out of your busy schedule.
Very much.
All right. Blessings
Thank
to you,
very
Nelda.
much.
Have a good night. Thank you all. We'll see you next in 2 weeks.